questions for the subject of oral pathology. All of you know the question paper was not that tough. Most of the questions were basic, were at the basic level, and almost like a single liner questions. Most of them were like a single liner questions. I hope I'm audible and you can see my screen. So directly I'll start with the discussion here. The first question here says, which of these is the most important or most common inheritance pattern seen in anhydrotic ectodermal dysplasia? So to clarify this first, what is this anhydrotic ectodermal dysplasia? See, this is anhydrotic ectodermal dysplasia. What is anhydrosis? Anhydrosis means less sweating or no sweating. Ectodermal dysplasia is one particular skin disease in which the sweat glands will be hypoplastic. So if the sweat glands are totally hypoplastic or totally absent, then the person won't sweat. That is called as anhydrosis. There is another type of ectodermal dysplasia called as hydrotic type. Hydrotic type. What is hydrotic type? In these individuals, there won't be any issue in sweat glands. So hydrosis or sweating will be normal. So that is not of the concern here for us. The question here says that clearly, what is the most common inheritance pattern that you see in anhydrotic ectodermal dysplasia? The answer is a simple single liner question, that is X-linked recessive disorder. Ectodermal dysplasia has got different inheritance pattern. Okay, but among that, the most common pattern is X-linked recessive. Now, how to explain this X-linked recessive? All of you might be knowing about the condition called as hemophilia, right? Hemophilia, it's a bleeding disorder. So this hemophilia is also even exhibiting X-linked recessive disorder. It is also X-linked recessive. Even anhydrotic ectodermal dysplasia is also X-linked recessive. So these X-linked recessive disorders, they follow one pattern called as Lyon's hypothesis. What is the name of the hypothesis? The name of the hypothesis is Lyon's hypothesis. Sorry. Lyon's hypothesis. So according to Lyon's hypothesis, any condition which is X-linked recessive, okay, the females will be basically the carriers and the males will be the sufferers. Okay, they will be suffering from the disorder and females will be the carriers. Why? Because females will carry XX chromosome and males will carry XY chromosome. Okay, so that is a hypothesis we are supposed to remember about the Lyon's hypothesis. So this can be also, and one more important MCQ, what is the Lyon's hypothesis or where it holds good with or where it is useful. Okay, next. Moving on to the next question here. Syndrome associated with oral malignancy. See here, it's very simple. If you see the different syndromes, Peutz-Jeghers syndrome. What is the most common oral manifestation associated with Peutz-Jeghers syndrome? Just remember P for P. How to remember this? I'll remember P for P. P is pigmentation. P is pigmentation, right? So Peutz-Jeghers syndrome exhibits pigmentation. It doesn't exhibit any, it doesn't have any oral malignancy. Gardner syndrome. What Gardner syndrome will have? Gardner syndrome patients will have oral or jaw osteomas. There won't be any malignancies here. Oral or jaw osteomas. what Gorlin-Gott syndrome patient will have? Gorlin-Gott syndrome patients will have multiple OKC. So obviously the answer is straightforward and simple, xeroderma pigmentosa. So xeroderma pigmentosa will basically have the xeroderma pigmentosa. One second. Xeroderma pigmentosa will basically have oral malignancy, particularly squamous cell carcinoma. Xeroderma pigmentosa is one particular skin condition where there is increased risk of skin malignancies, mainly melanomas and basal cell carcinomas. Even you can see oral malignancy also. So the correct answer here is xeroderma pigmentosa, right? So that's a question here. So that is why you have to rule out the all the options. So here the best option here is xeroderma pigmentosa. Now moving on to the third question. Third question is a straightforward one which has been discussed very frequently. The image below shows a matrix of mucoid and myxoid regions along with the duct-like structures. See, if you see these two words, what are the two words here? One is myxoid, another is duct-like structures. If you see these two things, myxoid, what do you mean by myxoid? The word myxoid means loose area. Loose area. That is called as a myxoid area. Loose area. So in particular one condition where you see this loose myxoid areas is your pleomorphic adenoma. So pleomorphic adenoma is the correct answer here, where you will see this loose myxoid areas. Okay, so in this image you can see clearly there are certain areas here, loose areas. Here there are certain areas loose. So these will be loose areas. So such a loose myxoid area with duct-like structures. I hope you can see some here ducts here, some ducts here. So multiple such ducts will be there. So ducts and loose myxoid area is characteristic of pleomorphic. So another very important feature you should remember is you will also see chondroid areas. Along the myxoid areas, you will see chondroid areas. That is why they characteristically call it as chondromyxoid stroma. Very typical MCQ. This is a very typical MCQ. Where do you see chondromyxoid stroma? Chondromyxoid stroma is a characteristic feature of pleomorphic adenoma. Pleomorphic adenoma. Okay, so that's a question here. Third question, that pleomorphic adenoma will show characteristic loose myxoid areas. Let us move on to the fourth question here. Histology of a pathology that is shown here, which shows spaces with hyaline material. You can see here carefully. There are some spaces here. There are some spaces here. All these spaces. They are having hyaline material. What is hyaline material? Pink material within it. And perineural invasion. This is a very important term. Along the nerve, the tumor cells are invading. So this particular histopathology is called as Swiss cheese pattern. What is this called as? It is called as Swiss cheese pattern. Swiss cheese pattern. What is Swiss cheese pattern? It is an histological pattern characteristic of a tumor, that is adenoid cystic carcinoma. That is adenoid cystic carcinoma. So adenoid cystic carcinoma will show this characteristic Swiss cheese pattern. What do you mean by Swiss cheese pattern? Multiple spaces will be there, and those spaces will be filled with pink eosinophilic hyaline material, and you will see characteristic perineural invasion. What do you mean by perineural invasion? Along the nerve. Suppose this is the nerve. Suppose I draw this as a nerve. This is a nerve. tumor cells will be spreading all along the nerve like this. So this method of invasion is called as perineural invasion. So perineural invasion is a characteristic of the salivary gland malignancy, that is adenoid cystic carcinoma. Adenoid cystic carcinoma is also synonymously or very famously known as cylindroma. Cylindroma. We are supposed to remember this synonym also, cylindroma. One more point I just want to highlight here is that the perineural invasion can also be seen in one more tumor, that is PLGA. PLGA. What is PLGA? It is again a salivary gland malignancy which is low grade, that is polymorphous low grade adenocarcinoma. Even PLGA, that is polymorphous low grade adenocarcinoma, also shows this the perineural invasion. Okay, is it clear? Next, let us move on to the next question here. A specimen or the histopathology shows 6 to 9 layers of epithelium, prominent stratum granulosum. The question says here is that, one second. Prominent stratum granulosum. See, whenever you hear of this prominent stratum granulosum and cystic epithelium, basal cells which are cuboidal, always think of OOC. The main difference between OOC, what is OOC? Orthokeratinized odontogenic cyst. We have two types. One is orthokeratinized odontogenic cyst, one more is OKC. That is OOC versus OKC. OOC versus OKC. OOC is the one which will have this prominent stratum granulosum, whereas OKC will not have this prominent stratum granulosum. OOC will have cuboidal basal cells, whereas OKC will have columnar basal cells. That is a basic difference you have to remember. The basal cells in OKC will be tall columnar, exhibiting that characteristic tombstone appearance. However, in OOC, that is orthokeratinized odontogenic cyst, that characteristic tombstone appearance is absent. So we should remember that whenever you see this prominent stratum granulosum, that you have to always think of OOC. Okay, let us move on to the next question here. The next question says, the lesion below shows atrophic epithelium. First point, atrophic epithelium is very thin. Juxtaepithelial fibrosis. Juxtaepithelial fibrosis. What do you mean by juxtaepithelial? Juxtaepithelial is a term for just below the epithelium. Just below the epithelium. So there, just below the epithelium in the connective tissue, there is fibrosis and homogeneous collagen deposition. What do you mean by homogeneous collagen deposition? That is another term that is called as hyalinization. What is hyalinization? Hyalinization is nothing but the term that is used for hyalinization is a term that is used for the homogeneous collagen deposition. So the characteristic lesion or the answer here is submucous fibrosis. So in submucous fibrosis, oral submucous fibrosis, which is a potentially malignant disorder, in this particular disorder, the oral epithelium will be thin and the connective tissue below the oral epithelium will be having fibrosis and hyalinization of the connective tissue. So this is the one that you have to remember, that in oral submucous fibrosis there will be hyaline. So these terms are very important: atrophic epithelium, juxtaepithelial hyalinization. Okay. Now let us move on to the next question. This is a straightforward question. There is nothing to discuss in this question. That in enamel caries, which is the correct order? So if you see this, if you go from the deep to the surface area, the second layer is the most, that is the most common, that is the pattern that you see. Translucent zone, above that you get dark zone, then you get the body of the lesion, then you get the surface area. So this is the, like from the dentine, if I go, first will be translucent, after above that I'll get dark zone, above that I'll get body of the lesion, and top surface, that is near the oral surface, I'll get the surface layer. This surface layer. These are the 4 layers that you see in the enamel caries. So you have to remember this order. Okay, that is very, even you can get this question even in dentine caries also. In dentinal caries also we have order. So we are supposed to remember this order. Either you can go from below to the top or from top to the below. Any order you have to remember, but you have to remember one side anyway. Okay, and for both enamel and dentine caries you have to remember. Okay. Next, the image shows excessive keratinization with excessive proliferation of epithelium into connective tissue. See, 2 things are there here. One is, what are there in the question, what are they trying to explain here? Excessive keratinization. That means excess of keratin is produced here, more keratin, and proliferation of the epithelium into connective tissue. That means epithelium is entering into the, has already entered into the connective tissue. So 2 things are there. Number 1, that there is excess keratinization. Number 2, there is invasion. If epithelium invades into connective tissue, what you will call it as? You will call it as malignancy. Okay, so the below image that you are seeing here is of a malignancy. Okay, what is the question that they have asked here? The question here they have asked is, this is a well differentiated carcinoma. It will result in malignancy. Substantially it will develop into malignancy. Definitely it leads to malignancy. See, these are the simple ways to confuse you. See, simple concept. That is why I always say during my classes also, keep the concepts very simple. What is the concept? Concept is 2 things. One is, there is excess keratinization. Number 2, there is invasion. Whenever there is invasion, we are going to call it as malignancy. So obviously this is malignancy already, and the clue they have given is excessive keratinization. So which grade will show excessive keratinization? Well differentiated squamous cell carcinoma. So the correct answer here is well differentiated squamous cell carcinoma is the one which is the answer. Why we are choosing well differentiated? Because in well differentiated squamous cell carcinoma, always the keratinization will be more. You will see more keratin pearls. You will see more squamous pearls, epithelial pearls. You will see more individual cell keratinization. However, in poorly differentiated carcinoma, this degree of keratinization will reduce. Okay, let us move on to the next question here. Geometric glossitis is caused by. See, this word is very characteristic. What is this geometric glossitis? Geometric glossitis is a term in which the tongue will show inflammation, and that too like a map like area. So you might have seen, all of you might have heard about geographic tongue, right? So similarly, the term geometric glossitis is a term that is used for herpes. So in herpes infection particularly, you will see oral lesions that is called as geometric glossitis. Okay, everything is straightforward, simple, single liner. That is what I always insist you, make your reading very easy. Don't read complicated things. Most of you think that if I read most difficult things, I'll clear the exam. It's not like that. The most common things you have to repeat multiple times. That is the key for success. You should, what we will do, the most common things we will read 1 or 2 times. The most difficult times most difficult concepts we try to understand, most difficult things we try to remember, which are very rarely asked. Okay, so this is the way you have to, that's the most common problem or the most common way the students usually approach for the exams. So geometric glossitis, simple, single liner. In herpes infection, particularly herpes simplex infection, the oral tongue will show depapillation, that will be not uniform depopulation. Some areas there will be depopulation, some areas it will not be there. The term that has been given is called as geometric glossitis. Okay, that is answer. Now, salmon patches are, what are salmon patches? Salmon patches is a term that is used for the vascular malformation. All of us know that there will be something called as hemangioma and vascular malformations. Salmon patch is a congenital patch. It's a type of congenital lesion which is a vascular malformation. Okay, let us move on to the next question. Maximum pigmentation is seen in the oral cavity. The maximum pigmentation we see in gingiva, because melanocytes are maximum in gingiva. Your second area, if you have to choose, that is hard palate. The most common area will be characteristically gingiva. Gingiva has got typical racial pigmentation. Okay, it has got physiological pigmentation because of the melanin. So usually the melanin depends. That depends. Sometimes in normal healthy individuals also you will see a lot of melanin pigmentation in the gingiva. The most common area where you see oral pigmentation physiologically is gingiva. Okay. Again, pseudocapsule is seen in which of the following fungal infections? So there are 4 fungal infections here. Again, this is a characteristic single liner MCQ that cryptococcosis is basically the fungal infection where we are going to see this pseudocapsule. Actually, pseudocapsule is not a true capsule, which will be there around this particular fungus, Cryptococcosis neoformans, and which can be demonstrated by India ink. Okay, that's again a very characteristic question, which is usually asked even in microbiology also. Okay, a pregnant woman was prescribed antibiotics for an infection. So, woman is pregnant and antibiotics has been given. The child, that means the child after the birth, exhibits brownish discoloration of the teeth. So which antibiotic could be responsible for this? All of us know that tetracycline and derivatives of tetracycline, that is chlorotetracycline, oxytetracycline, all these cause brownish reddish brown discoloration or brownish yellowish brown discoloration of the teeth. So such teeth, if you use the wood's lamp, there is something called as a source of UV light, wood's lamp, wood. That wood lamp, if you just use that wood lamp, the teeth will fluoresce. That is called as tetracycline staining. So this tetracycline, so the correct answer here, what it could be? So it could be because of tetracycline, it could be because of oxytetracycline. So answer here is basically the 4. That this is because of the tetracycline or oxytetracyclines. Okay. Tongue metastasis is seen in. So that means any particular tumors which can spread to tongue. Lung cancer, yes. Skin cancer, kidney cancer, breast cancer. If you see this, skin cancers are very rare to spread to tongue. Usually it's basal cell carcinoma, which is the most common skin cancer, does not metastasize. It is locally invasive. Okay, so usually, so the correct answer would be ACD. Okay, so the correct answer is straightforward here, that it is ACD. That is, lung cancer, kidney cancer and breast cancer can spread to the tongue. Okay, moving on to the next question here. A radiographic image of a 12-year-old boy with the multiple decayed teeth and history of non-Hodgkin's lymphoma. So child is of 12 years. So remember, first in such questions, always remember there any particular question, any particular history they are giving, it will be always of a use. Don't neglect it. Like they're giving 12-year-old boy. Multiple decayed teeth are there. Child had non-Hodgkin's lymphoma. The child received the chemotherapy. What is the condition? If you look at this image, typically the condition here, if you see carefully here, I'll just zoom, I'll just circle for you this condition where the teeth are very small, roots are very small, teeth is also very small, is called as stunting. So stunting is a particular condition in which you see that teeth will be very small in size, roots will be very small in size. That usually occurs because of any kind of drugs or any kind of condition, malignancy that is seen during this particular time when these particular teeth are developing. Okay, that is called as stunting. Coming to the last question for the subject of oral pathology, how is a widened and elongated coronal pulp chamber represented? The question is a bit incomplete. It is that they want to ask it in dentine dysplasia. So in dentine dysplasia, how is the enlarged coronal pulp described as? All of us know it's again a straightforward thistle tube, or it is also called as flame shaped. It is also known as flame shaped. So thistle tube or flame shaped enlargement of the coronal pulp is seen in case of dentine dysplasia. So tulip shaped, there are other terms that they have given: tulip shaped, dumbbell shaped, test tube shape. All those are different shapes that are not specific for any particular this one. Coronal pulp chamber enlargement that is characteristically seen in dentine dysplasia is called as thistle tube or flame shaped pulp chamber. Okay, so that's the last question for the today's discussion. These are the questions that have been recalled, INICET recalled paper. All the questions, say all the questions have been discussed during our sessions, and none of the question is like complicated or any difficult question. Every question that is asked here is straightforward question. That is why I always ask you or recommend you to remember simple things. First point, repeatedly revise them. Common things, not simple, I mean to say common things. Remember them, revise them, try to understand concepts, and while solving each MCQ, try to learn a certain point. For example, how I have discussed this. See how I have discussed this question. I could have directly told that xeroderma pigmentosa. Now, you have to remember that in Peutz-Jeghers syndrome, what is the oral feature? In Gardner syndrome, what is the oral feature? That is the pattern of or way of studying for the exam. Okay, I hope all of you have got the concept, and any doubts you can ask me now or later also. Feel free to ask any kind of doubts. I'm here to clarify it. Okay, thank you very much. Any doubts? Otherwise, we'll close the session. This was session exclusively for the